name is Ashley Lesko, and I'm a student nurse at Cedar Crest College. My topic for my evidence-based practice paper and poster was shift length and patient safety. The significance of this problem, according to Stimfel ETAL, is that shifts that are 12 hours or longer decrease patient safety and the amount of poor outcomes for the patient. There's also an increase in the amount of infections with longer shifts, such as central line infections and UTIs. In turn, 8-hour shifts decrease the amount of infections and poor outcomes for the patients. My PICO question is, in the acute care setting, do nurses who work 12-hour shifts or longer compared to 8-hour shifts decrease patient safety? In my literature search, process of the literature search, I used Google Scholar to find out if there was enough information on this topic to proceed with my paper and poster. I used keyword searches such as patient or shift length and patient safety, or 12-hour shift versus 8-hour shift in nursing. Once I figured out there was indeed enough information on this topic to proceed, most of my articles came from PubMed, and I made sure they were all current from 2008 or sooner, relevant to the topic, and reliable, which would be peer-reviewed. I also used a couple of different evaluation tools. The Johns Hopkins Evidence-Based Practices rating scale was used to evaluate the quality of the articles that I chose. I used the top 3 articles in my paper, which were all awarded a letter B. The Maylink and Finout over Holtz rating scale was also used. Rating system was also used to evaluate the strength of each of the articles. My top 3 were all a level 4, a level IV or 4. So each 3 in my evidence-based table, which is shown here. The first one is Griffith's ETAL, which is the only of the sources that was from Europe. This was a cross-sectional survey that shows that shifts that were greater than 12 hours or greater, and overtime decreases the quality, safety, and the amount of tasks that were left from the nurse to the patient. Stimpson and Aiken, which is my second article, was a secondary analysis of a nurse survey. And this showed that shifts that were 10 hours or longer had nurses that reported that the care was fair to poor. 8-hour shifts to 9-hour shifts showed that there was the fair to poor was decreased, so quality was increased. My Stimpson ETAL is also a secondary analysis, but of a cross-sectional nurse survey. And this showed that shifts that were 13 hours or longer than 13 hours had more negative job outcomes, decreased quality, safety, and tasks left undone. This was versus when an 8-hour shift, nurses that worked 8-hour shifts had increased quality and safety and less negative outcomes. The recommendations would be, first, according to Stimpson and Aiken, that to change from 12-hour shifts or longer to 8-hour shifts to improve the safety for patients and nurses. The second recommendation would be to hire more staff according to Stimpson. This would increase the safety for these patients and the nurses as well. The last recommendation would be to decrease the patient load, according to Griffiths, to increase safety, and quality of care for the patients from the nurses. In conclusion, it is seen that 12-hour shifts decrease patient safety, decrease nurse safety, and decrease the quality of care provided from the nurse to the patient. There's also a higher amount of tasks that are left undone with longer shifts, 12 hours or longer. In turn, it is seen that 8-hour shifts are much safer for both the patient and the nurse. There's also less tasks that are left undone, which increases the satisfaction for the patients. Thank you for watching.